Good evening, everyone. As Maya Angelou once said, life is not measured by the number of breaths we take, but by the moments that take our breaths away. We are gathered here today to inform you about cystic fibrosis. Knowledge of cystic fibrosis is important because there's so many children and young teens that are being diagnosed with it yearly. My good friend from high school is actually diagnosed with the disease, which makes me want to bring the awareness further out to you guys. I'm going to talk to you about cystic fibrosis and who it affects, what the body parts it affects, symptoms, and the treatment process for it. One must simply understand what cystic fibrosis is and who or what it targets. Cystic fibrosis is an inherited disease and is commonly diagnosed in children and young adults or teenagers. An autosomal recessive gene is what causes cystic fibrosis. This was discovered by doctors and physicians who ran tests, numerous amounts of tests, of blood tests and gene tests on families that have the disease. And that just essentially shows how it detects the genes that are within. Cystic fibrosis is caused by mutations in the CFTR gene, which provide instructions to make a protein that channels salt within the membranes in the body. Typically, when a gene is autosomal recessive, it essentially means it needs exactly 2 copies of that same gene and can occur on any chromosome. Since cystic fibrosis is a rare disease, only about 30,000 Americans have this disease, and about 70,000 people worldwide are diagnosed with this disease currently. Doctors may question if a patient has CF based on a large variety of things, or symptoms, so to speak. Children and teenagers can show many different symptoms, along with having positive blood and gene tests that can determine whether or not someone has cystic fibrosis. The parts of the body that are affected from cystic fibrosis are the lungs, the pancreas, the liver, intestines, and other organs within the body. Obstruction to the lungs can result in infections such as bronchitis and pneumonia. Obstruction to the pancreas because of CF can lead to malnutrition and poor growth. There are many different symptoms a person with cystic fibrosis can have, such as salty tasting skin, coughing, shortness of breath, poor growth and poor weight gain, and repetitive lung infections. And there's many other ones that are, discussed about as far as symptoms are concerned. The thick and sticky mucus associated with cystic fibrosis causes the tubes that carry air in and out of the lungs to clog. So basically when the lungs clog, it causes a bunch of build up in the airways, which then leads to the pneumonia and the bronchitis. And that's what makes people very sick. After diagnosing someone with CF, families monitor the symptoms to ensure proper treatment occurs. On here, there's a picture of someone's finger that's clubbed. I don't know if you can see it that great. So finger clubbing is also something that can happen to somebody that has cystic fibrosis. Treating the symptoms of cystic fibrosis can promote a longer lifespan and can provide a much more enjoyable, painless lifestyle. Cystic fibrosis does not have a cure, but the symptoms associated with this disease can be cured, depending on, essentially what it is. The treatments have changed greatly over the years, so they become much more advanced, thus providing a longer lifespan for people with the disease. Treatments can include a combination of the following therapies, such as airway clearance, inhaled medications, pancreatic enzyme supplements, individual fitness plans, and CTFR modulators. So, Patients that have CF may be prescribed antibiotics, bronchodilators, or mucus thinning medications. These medications help treat and even prevent some of the illnesses from occurring. It reduces swelling, opens airways, and thins the mucus. Injections of normal genetic makeup have been placed into the airways, and it essentially clears them out. So, using medications and other treatments can subside the basically the side effects of cystic fibrosis. It just, helps treat the symptoms. The average person can live to approximately the age of 37, but some can live up to even their late 40s as long as you treat the symptoms of cystic fibrosis within a timely manner. I hope this gives you some insight on cystic fibrosis and how it affects people and what body parts are affected, the symptoms, and the treatment. As Rob Bell once said, that breath that you just took, that's a gift, because not everybody gets to have that last breath. Thank you for watching, everyone. I hope this gives you some insight on cystic fibrosis.